Hey, thank you very much, Angela. And again, my apologies to everyone. Technology, gotta love it. So thank you for this opportunity to speak today. Again, this presentation is going to be a little bit different from the great scientific presentations I've seen held in this webinar. I've had a few alumni reach out to ask what I've been up to and what life at the Centers for Disease Control and Prevention has been like, especially during COVID, and especially in the National Institute for Occupational Safety and Health. And I wanted to use today's time to give you a brief peek of what my life is like as a research health scientist to help you, those of you who are thinking about starting the next steps after your graduation or in your career. So I'm just going to start with a polling question. So for all the students that are online right now, where do you want to work after graduation? And so here are your choices. Do you want to be in academia? Do you want to be in private industry? Government? Do you want to do more school? Something I haven't thought about, or I haven't even thought about graduation. So I'm just going to wait for some answers. We've got, government's lead, private industry, good money in industry. Yes. Not a whole lot for school. Okay, so it looks like it's almost a tie between private industry and government regulations. So I'm just going to take a screenshot of this because I'm going to do a side-by-side comparison in just a sec. And now I'm going to ask folks that are on the line who are, whoops. Can you see the results?
Yep.
Excellent. So you can see there's private industry and government regulations are almost neck and neck. So I'm going to close that out. And so now I'm going to go into the second question for our graduates. Where did you end up after graduation? So same list. And then the last one is, I'm still trying to find my way. I'm still trying to find my way. Retirement's looking really good about these days. Okay, we're getting there. Oh, this is interesting. Okay, so I'm just gonna, we're getting almost there. Okay, so I'm gonna share the results. You can see here, most folks have ended up in government because, we love working for the government. So I'm just gonna share the results. It looks like most folks ended up in industry and government. Just give me a second here. I'm just not going to do this. So we can see a lot of folks ended up in government. A lot of people thought they were going to be in industry. It's kind of an equal share. So why does this matter? Doesn't really, but it's kind of an interesting question to ask. I actually ended up not really knowing what I thought I was going to do. I thought I knew I was going to do, but I didn't. And I just want to encourage you to keep your minds open and explore. And there's a lot of different opportunities out there. So I'm currently at NIOSH. And where does NIOSH fit into the federal organizations for workplace safety and health? We're a US federal government agency that's part of the Department of Health and Human Services, and we're under the umbrella of the Centers for Disease Control and Prevention. We were created in 1970 by the Occupational Health and Safety Act, which was actually an action by the Nixon administration. We're a research agency focused on the study of worker safety and health, as you know, and we provide resources for employers and workers to create a safe and healthy workplace. And our main mission is to develop new knowledge in the field of occupational safety and health and to transfer that knowledge into practice. And so that makes us really different from OSHA, or the Occupational Safety and Health Administration, which is under the Department of Labor and really concentrates on the development and enforcement of safety standards. So they're really more on the regulatory side, which doesn't work for my personality, but it's a good thing I'm not there. But I know some colleagues that are thriving in that kind of environment. As you can see here, NIOSH and OSHA are two very distinctly separate entities with very different purposes, but we work very closely together. Our NIOSH campuses are spread out over 8 different cities with headquarters located in Washington, D.C. We have over 1,300 employees from a diverse set of fields, including epidemiology, medicine, nursing, industrial hygiene, safety, psychology, chemistry, statistics, economics, and many, many branches of engineering. My current duty station is Cincinnati, but since the pandemic, we've had a lot of workplace flexibilities that we're still really trying to navigate. I have to admit, though, when I got this job, I really didn't know anything about Cincinnati or where it was, except for the TV show that some of us in a certain generation might remember. So my next question is, how many NIOSH products have you used? So here's some examples. Here's the NIOSH alert to prevent lung disease amongst workers who use or make flavorings. What really got me interested in occupational safety and health is talking to Karen Bartlett. And when she told me about the seemingly innocent butter flavoring that was leading to serious permanent respiratory damage amongst workers, some workers experienced chemical eye burns and skin irritation. I never thought that could be something that I enjoyed could be so harmful to someone else's health. And it's really just microwavable popcorn, right? So this led to the development of criteria for recommended standard for diacetyl, as you can see on the bottom left-hand corner. NIOSH has also developed the Manual of Analytical Methods that includes guidance for air, surface, blood, and urine methods. And here's the NIOSH Pocket Guide to Chemical Hazards, which I carried with me for probably my first year of grad school, which I hear is now a mobile app. So I guess that kind of aged me a little bit. Aside from the traditional industrial hygiene and chemical and biological exposures, there's been a huge shift to social science and organizational psychology in the past 2 decades. And again, the newest additions, as you see here, are mobile apps like our lifting equation calculator and the heat safety tool and the sound meter app. And as I'm talking, I can see there's lots of people already in the poll. So as you can see, this is great. More than 4. Everyone is using our products, which is nice to see. And there's a couple that have not gotten a chance, but we'll check them out. That's great. Okay, so one more thing. Oop. I will share the results. There you go. You can see more than 4. Excellent. And with that, I'm going to move on to the next slide. One more bit of trivia about all these things that I just showed you. They were all developed in Cincinnati NIOSH. I know the folks that have worked on these products and continue to update them. As you can imagine, it takes a really large team and a concentrated and coordinated effort. Some of these are the nicest people you could imagine working on some pretty interesting stuff. So more specifically about my day-to-day work, I'm employed as a research health scientist specializing in industrial hygiene and epidemiology. However, as you heard, my main role is program leader for the Center and Work Fatigue Research. So while NIOSH has had a long-standing history addressing occupational health and safety concerns related to non-standard work schedules and sleep, the center was really created to expand our efforts following our inaugural Working Hours Sleep and Fatigue Forum in 2019. We are one of 8 virtual centers across NIOSH. We have over 50 NIOSH members with from various disciplines, with representation across most of our divisions and sectors, which are our industries, and cross sectors, which are cross-cutting areas such as chronic disease or injury prevention. We are a diverse but interdisciplinary group that's very cohesive, and we address a number of different topics from a number of different perspectives. Our vision, as you can see here, is safe and healthy workplaces free from the effects of consequences and fatigue. And through partnership and collaboration, the Center for Work and Fatigue Research focuses on raising awareness of the different sources of worker fatigue and associated health and safety risks. So in addition to work hours, we're looking at things like physical mental demands and other occupational or environmental exposures. We focus on identifying effective methods of assessing fatigue risk in workplaces and developing and communicating strategies to reduce the health and safety risk associated with workplace fatigue. The goal of the center really is to provide a service to the Institute by building strong internal and external collaborations, both multidisciplinary and multi-institutional. And we continue with our NIOSH tripartite approach in bringing together research, industry, and labor groups who are equally valued to develop practical responsive solutions and novel outreach initiatives. So across NIOSH, we have an increasing number of researchers pursuing studies in this area and fitting into the 4 elements of industrial hygiene, as you all know: anticipation, recognition, evaluation, and control. And as I understand, there's another C now, confirmation or confirm. And you can see projects span most of these industry sectors on the left. For anticipation-related projects, we have a number of surveillance and epidemiologic studies to identify determinants of fatigue, which could be industry-specific. Under recognition and evaluation, we're using a number of different methods, including standardized surveys and objective measures such as actigraphy. We are also examining the effectiveness of some fatigue detection technologies with a cautionary advice not to use this as your primary or sole mitigation strategy. For control measures, NIOSH has a rich array of online training, infographics, toolbox kits, and other educational efforts. We're starting to move into more shorter and more widely accessible methods such as podcasts and short course modules, which can be dropped into existing training programs or tailored together to fit a specific purpose. We have resources devoted to times of emergencies, such as with Ebola, and most recently with COVID-19. So I don't have to tell you that COVID has been on the forefront of everyone's minds in these past almost 3 years. We were very busy across NIOSH and CDC in different parts of the response that included developing products to manage fatigue during this very stressful time. In the early stages of the pandemic, we had to roll out fact sheets really, really quickly as part of the response process. And that really was an event in itself. The whole clearance process with that, it's kind of like walking a gauntlet. And these efforts still have to be, some of these efforts still have to be cleared by the White House. And to meet the demand for more information, we also published several science blogs, one with tips for healthcare workers and employers on how to manage fatigue during emergency or disaster responses. This is one of the top 5 NIOSH blogs in 2020. We had one for tips to improve sleep during challenging times. And our last in this series was COVID-19 and workplace fatigue. And this was one of the top 5 NIOSH Facebook posts from 2021. And as you can imagine, these products are available in multiple languages, and we've shared them with our colleagues internationally. We presented to about a dozen different audiences, ranging from our consortium of federal agencies, across our different industry sectors, and also with the National Safety Council. And to reach a wider audience, we expanded this presentation into an article for the Synergist. So some of you may know this as the publication for the American Industrial Hygiene Association, which I guess is going by AIHA these days. We were also asked by the CDC to develop some general information for the public regarding managing fatigue during any sort of challenging times, whether it be on a global, national, or even at a personal scale. So we're working on a video right now, 2 videos, in fact, one for workers and one for employers. And this will help us be better prepared for the next time a major challenge happens, and will give us time to develop situation-specific materials. We have several activities that live within our center. We're working with our colleagues from the NIOSH Health Effects Laboratory Division to review biomonitoring methods of identifying fatigue. And so there are hopes that this may be a precursor to developing a novel biological method of measuring fatigue. Our innovations for fatigue detection projects draw from increasing interest and emergence of many new fatigue detection technologies that are now commercially available. We are collaborating with 2 other NIOSH centers. That's the Center for Motor Vehicle Safety and also the Center for Direct Reading and Sensor Technologies on a series of research and informational activities. We published a series of science blogs on choosing the right fatigue detection technologies, tips for their implementation, and one for identifying what the objectives should be on incorporating fatigue detection technologies, because it's really not as simple as people seem to think it is. We're also planning other knowledge dissemination products and scientific studies about technologies that are currently being used, including what are their benefits and their challenges and the barriers to using them. We have also partnered with the US Department of Transportation and the NIOSH Center for Motor Vehicle Safety and the Center for Occupational Robotics Research to produce a series of products related to automation and assisted technologies. And I'm sure a lot of you have heard about these new, almost fully automated vehicles, such as our Teslas. This will emphasize the caution of over-reliance and increased fatigue with assisted technologies when vigilance is still needed. Lessons learned from these activities are used to inform about fatigue and situation awareness in industries such as transportation and mining and manufacturing, where they're relying more and more on these automated or assisted technologies. And of course, our work really benefits most when it reaches a wide audience. So in addition to our scientific community, we also strive to reach out to the general workforce population. As such, our knowledge translation is a core component of our center. We've hosted the NIOSH Director Seminar Series on work and fatigue, highlighting fundamental work from top researchers in this field, and past presentations are archived on our website. We will assist NIOSH researchers gain a wider reach with their products. We just recently published a special issue of the American Journal of Industrial Medicine following our 2019 fatigue forum. There's lots of really interesting information about sources of fatigue across industries and effective countermeasures. It's been interesting sharing across industries so that we can learn from one another. And we have a host of toolbox kits, online courses, and podcasts that have been developed, and more are on their way. We also publish a lot in trade journals like The Synergist, as you've heard me say, to reach a broader audience outside of our scientific community. The center itself also builds on many collaborations and partnerships. So here's a list of federal entities that I work closely with to develop a unified message about fatigue risk and mitigation strategies. It's been a tremendous learning experience to hear about what other agencies are doing and what challenges that they're facing. My networks are also extend to international collaborations, as you can see here, because there's a lot to learn on a global scale. There's some things that some countries can do that we are not quite as freely ready to do, especially within the United States. I know several of our SOE graduates have gone on to work in other countries on some pretty cool projects. So a large part of my work is also to provide consulting. As you can see here, here's a number of different examples. We were asked to review and validate some of the US estimates for the World Health Organization and the International Labor Organization's Global Burden of Disease study. So this was joint estimates of work-related burden of disease. A really interesting study which had two publications, one that focused on long work hours and associated with increased risk for ischemic heart disease and stroke. And the other one was more broad-based and examined 39 pairs of occupational risk factors and health outcomes. I'm also sitting on the National Safety Council Impairment Advisory Board. The National Safety Council is great in getting information out quickly and disseminating out to a large number of industry partners and also labor representatives. This impairment study that they're doing is related to physical factors such as fatigue, but they're also interested in impairment related to stress and mental distress and chemical substances like opioids and cannabis. And honestly, I'm really looking at Canada to see how things are being handled after the decriminalization of cannabis use across our country. I've recently been involved in a really neat collaboration with the National Institutes of Health and Department of Housing and Urban Development. They're trying to find ways to passively measure environmental conditions to improve sleep environments in assisted housing. So things like ambient noise, light, and even air pollution. Mike Brower, I've been thinking about the great GIS studies that you're involved with, and I shared some of those ideas with them about proximity to major corridors and highways and some of the exposures that come off of those high traffic zones. I know I just recently attended a SOE webinar that addressed these issues, and I've passed that information along, and we're still learning from one another. One of the best parts of my job is consulting with labor and industry. This really helps to keep me grounded. I don't really get a chance to get out in the field as much as I want to anymore. So speaking to industry and labor representatives gives me a better idea of what is working and where emerging needs might be occurring. And another best part of my job is mentoring early and mid-career researchers, which keeps me motivated, and I still learn a lot from them. So just a quick overview. I'm going to give you a quick overview of some of the scientific projects I'm leading. It's been an honor to learn from a number of different industries. Each have their own unique challenges with occupational safety and health. And I hope a quick snapshot on different industries and methods will give you an idea of where you might want to explore in your next steps. So here's the next polling question. Which one of these industries do you think has the highest occupational fatality rates? Is it construction? Is it public safety, which includes law enforcement and firefighters, oil and gas, mining, transportation, warehousing, and utilities? And I see the polls are coming in. It's looking pretty good. Okay, so I'm going to end the poll and I'm going to share the results. And it looks like almost half of our participants are saying construction has the highest occupational fatality rates. So what is the answer? Surprisingly, the answer is in electrical utility work. It's considered to be among the 10 most hazardous jobs in terms of work-related fatalities. So I understand maybe folks thought about construction in terms of occupational injuries, but according to our Bureau of Labor Statistics, it is electrical work. Oh, sorry, that was our census for fatalities and occupational injuries has reported that electrical utility work is highest amongst utility workers. In fact, the fatality rates are more than 3 times greater in comparison to all other US workers. Those at greatest risk, as you can imagine, are lines people who work at heights or confined spaces or around high voltage. Their work schedules can be long and unpredictable when responding to power outages, which seems to be on the rise with climate change issues. But they also have the most safety regulations and policy in place amongst electrical utility workers. However, despite all the hazards they face and the high fatality rates, they're surprisingly, it's a very understudied population. So what we're planning to do is to examine the association of work-related injuries with individual and environmental and occupational factors. How we're going to do it is a retrospective longitudinal epidemiologic study. We have 24 years of work history data from 20 companies linked to injury records and compensation claims. Tremendous amount of data, and I'm really excited to be working with it. For outcome measures, we're looking at work injury, days lost from work, injury compensation. Our main exposure variable will be job title, again, because we're looking at lines people if they do have the highest occupational risk for fatalities. So other exposure variables we're going to be looking at include things like work schedules and job tenure. We'll have individual level variables such as age, and other variables include month to identify seasonal effects, and also month and year to determine if there was a storm event during that work. And I'm also interested in looking at policy impacts, such as the 2005 Energy Policy Act that mandated additional efforts and consequently more work hours by electrical companies to upgrade the existing electrical grid. I have a couple of projects in the oil and gas extraction industry. Why? Transportation incidents are the leading cause of death in oil and gas extraction. In fact, almost 1/3 of workplace fatalities in the sector were due to motor vehicle crashes. To put this in greater context, motor vehicle fatality rate was 8 times higher than all other industries, second only to transportation, warehousing, and utilities. Some of the hypothesized determinants are the work schedules, long work hours, and long commutes, but there's other things like working alone, long stretches of boring driving along highways, and also seasonal effects, and also the long commutes that they face to get to these very remote sites. So one of the projects is investigating fatigue driving. We're going to use data provided by in-vehicle telematics companies. So those are the cameras that either face outward to see what kind of driving behaviors that the driver might be exhibiting, or maybe facing inward to assess what's happening in the cab. Some of the potential determinants include the daily miles driven, work schedules, season, job tasks, road conditions, and whether or not they receive coaching. The outcomes we're looking at, again, are in the vendor supplied data. They include risky behavior, such as hard braking, steering wheel correction, and laneway deviation. And if there is a camera facing inward into the driver, there's sometimes also videos of them actually nodding off. We're going to try to link to hard outcomes, but we don't have a good centralized compensation record keeping system like Canada does. So we need participating companies to provide that information regarding injury compensation and motor vehicle crashes. The other project is fatigue risk and management in oil and gas. We'll be examining determinants of high fatigue risk amongst service and drilling contractors, which are usually very small businesses. And we'll also be assessing for any fatigue management strategies and their benefits and challenges. So this will be a 3-part study. We have a field study to identify determinants of fatigue. We will be using baseline and pre and post shift surveys, actigraphy, and daily psychomotor vigilance tasks. So basically that's kind of like almost like a computer game on a tablet, and you test people's reaction times and their ability to react not only quickly, but also correctly. We'll be also looking at focus groups of workers and employers and asking in them about their perceptions of what fatigue means, because I think we all have a general idea of what it means, but it doesn't quite always mesh. We're going to ask them what the contributors to fatigue are, if it hampers their work and safety, And how do they manage it? Is it through formal policies, or sometimes workers have some really great informal methods, such as creating a buddy system to look out for each other? And we also plan to interview oil and gas leaders and subject matter experts about their overall perspective of the use of fatigue risk management systems in oil and gas and their benefits, challenges, and barriers. In 2015, NIOSH published an online training program for nurses who work shift work and long work hours, which serves as the cornerstone of our other sleep and fatigue education and training products. And almost 10 years later, we would like to evaluate this program to determine if any changes are needed because the technology and work environment has changed dramatically. We'll be assessing the uptake and reach across the US nurses workforce population. Specifically, we want to know, are there specific groups where there is high or low patterns of usage, and to identify where we might be need to put in more efforts in promotion. And we'll also examine the effectiveness of training at actually improving nurse sleep and fatigue. So how we're going to do this, the first part is to use data that's already been collected by the CDC about nurses who have been awarded continuing education credits for taking this course. So we'll be looking at the usage across the United States, not only geographically, but also within different occupations of nursing or sub-occupations of nursing. And our preliminary results show that predominant users are from nursing schools. So for me, that's really encouraging to know that we're getting this education out to nurses that are early on in their career to hopefully stem any sort of risks that they might have or safety concerns they might have as they progress further on in their career. The second part of our study is a field study where we'll be recruiting approximately 50 nurses who are working night shifts, and we'll be assessing their sleep and fatigue with sleep diaries, surveys, and actigraphy, both pre and immediately post-training, and also at 1, 3, and 6 months. So a long time to be following up with folks. But I'm really excited about this one. My most recently awarded project is Better Together, a mental wellness support system for long-term care health workers and employers. This is one of 5 projects supported by the CDC Mental Health Initiative for health workers. Why? Well, I think we're all aware that COVID really brought to light the difficulties our healthcare workers are facing, and especially even across the nation with everyone, mental health is really becoming a prominent concern. Even before COVID, health workers in long-term care facilities reported the highest prevalence of mental distress, not only compared to all workers, but also all categories of health workers aside from home healthcare workers. And 2 years after the declaration of the national emergency, our reports are showing us that residents and staff are still, infections across staff and residents are still reaching record highs. And so what's also adding the concern for this particular workforce are the nursing shortages and increasing demands for long-term care. So what is a mental wellness support system? So we're proposing a multi-component system with shared responsibilities between employers and workers that include, as you can see here, employers' resource toolkit that includes a decision matrix to assist managers determine what actions are needed, a template to clearly identify roles and responsibilities across all members of long-term care facilities. So that includes leadership, employees, and also managers. We'll have a risk assessment and resource guide with individual and organizational level metrics that can be tracked and evaluated. And to ensure the system remains relevant, we'll include an audit and evaluation tool that we can continually reassess to see if this system is effective and relevant, or if there are changes that need to be made. And finally, we'll be providing information to workers and employers for mental wellness and education. This includes information and strategies to improve mental health, sleep, well-being, and work-life support. And so this includes things like peer-to-peer support, because we've learned that having someone there to listen is almost as important as having a clinical care. So how we're planning to do this, we're currently working with our advisory board of long-term care workers and managers, nurse researchers, and mental health experts to develop and refine our system. Following the development, we will test for feasibility, adoption, and preliminary effectiveness. We'll use objective metrics such as how often the different components are being used or downloaded. And of course, we'll survey for any changes in mental well-being and additional feedback on their perceptions of acceptability. So I've recently started moving more into the policy space with my time in the CDC Policy Academy. Why? Because policy analysis and support constitutes a large part of my role as the program leader of the Center for Work and Fatigue Research. My work often involves commenting on rulemaking and policies from other federal agencies or providing evidence-based, unbiased guidance in the development of their own internal policies. I've developed skills to better bridge science and policy more effectively and hopefully more efficiently. Um, what I learned was about policy analysis, research, evaluation, assessing evidence, and modeling. And so this includes things like strategic planning, systems thinking, stakeholder engagement, and translating that science into policy, because a lot of our policymakers are, I very respectfully say, are very intelligent, but they're really not interested in knowing about our odds ratios or anything that's science-y that way. My topic for the Policy Academy was COVID-19 policies affecting the mental well-being of health workers. So you can see it's kind of tied on to that last project I was telling you about. My coach was Frank Hurl, who just retired as an IAS Chief of Staff. He also acted as advisor to the White House on COVID-related policies, in particular with the meat and poultry workers. And he's shown me some stuff that would just make your hair stand on end. I also had my longtime mentor, Roger Rosa, a senior science advisor, also as a mentor, and he's also a legend in shift work research. This was a year-long workshop, and I just graduated in December. Information from my project will be used in Dr. Walensky's, who's the CDC director, some of her upcoming talks. So what an honor to be able to provide some information to our parent organization. I'm still working on this project. I don't think it's ever really going to end, but I'm looking forward to using these skills that I've learned in the Policy Academy in other areas of occupational safety health and the broader realm of public health. So what's life like at the CDC? It's not just within NIOSH, but we also can reach across to our parent organization and have lots of other opportunities. So you heard me say CDC is part of the Public Health Service, and we respond to public inquiries and emergencies. But a response is not really limited to the United States. Some of my colleagues have been on the Global Rapid Response Team, and they've been active on a variety of global public health concerns. Some recent examples of deployments include, well, not surprisingly, COVID, which included virtual deployments and field deployments. Some of my colleagues were sent to airports during the early stages to take temperatures when people were still traveling, and to meet in poultry plants to devise safe work environments. Monkeypox is a priority for many teams right now. We also provide on emergency relief with environmental disasters such as Hurricane Ida. You can see here we are also involved with the Office of Refugee Resettlements, which provides a safe environment to unaccompanied children who arrive at the US borders. And these were really heartbreaking situations, which still continues to be an issue today. Our Operation Allies Welcomes helps other federal governments to support vulnerable Afghans as they safely resettle in the United States. And CDC, I'm not sure if you've heard, is currently undergoing some major restructuring to provide quick policy development, evaluations, and tracking. And as you can see here, the possibilities are endless. So no matter what I'm doing, I carry with me some critical lessons that I learned at SOE. So without ado, here are some lessons I learned from Hugh, or what I call Hughisms, which I was surprised to learn from the internet, maybe copyrighted material, I'm not sure. Maybe Hugh, you've been busy since I've seen you. I'm not sure if Hugh still says these things, but I'm happy to relay them to you. So the first one is, you always said to me, don't throw out the baby with the bathwater. I can't believe how many times I've said this to my mentees. I think while we are really all eager to get the answer at the end, we also need to be considerate that we don't want to limit our possibilities by narrowing down the scope too quickly. Another one he also said to me was, don't overlook the low-hanging fruit. Sometimes in our eagerness to save the world, it's easy to overlook the small wins. So don't discount these. They are extremely helpful to gain momentum in your projects and your career. You need to grow thicker skin. I'm still working on this. I really am. Sometimes the feedback stings, but it helps to remember that most of the time it's meant to be helpful, and other times, well, haters are going to hate, but don't waste your time on those battles. And remember, the opinions that really count are the ones from the handful of people who mean the most to you. I just recently spoke to a friend of mine from our SOE days, and I said how much I appreciated the breadth of learning that we got in our small school. We were challenged in ways and learned so many skills that a lot of students don't get in larger schools or programs. not just with the science and theory, but also with project management and people skills. So here are some of the lessons I learned that I hope that you will also carry with you. Karen Bartlett was probably someone that I've seen that was self-sufficient. She just did everything. But we also learned that teamwork, and I remember that first Hell Week where we had to figure out PELs and RELs and stuff like that for chemicals. We had to work as a team, and so that was important. I learned everyone has strengths and weaknesses and valuable contributions, and to choose your language wisely and be relatable to everyone. Um, it's always easy to get mired in the details and go down those rabbit holes. So I like to pull back every once in a while and remember the bigger picture. It's easy to figure out the direction when you have a larger view of the map. Um, there's always a creative solution. I often I often run up against some sort of wall. These days, it's mostly bureaucratic, and most of the time, it doesn't make sense to me, and it's a constant source of frustration. But what I learn is there's always a creative solution. Sometimes you just have to take a step back, and it might not happen right away. In fact, some of my solutions came 6 or 7 years later, but they still came. You just need to be patient. Which brings me to be strategic and spot the opportunities. It's easy to get involved in lots of things because they all seem really interesting, but make sure there's a common thread amongst all of them. Sometimes it helps to have a mentor help you reframe things, especially when you're really in the thick of doing stuff and are worried about missing out on the opportunities. And trust me, the opportunities will always be there, so don't worry about that either. And always keep your sense of humor. If it's not funny now, it will be someday. And I promise you that really will happen. And with that, I thank you for your time and attention. I'm excited for all of you as you go through our school. Enjoy your time because it passes quickly. And more importantly, I hope you enjoy the journey.